What if I told you that the future of repairing a failing human pelvic floor might actually rely on purified DNA extracted from salmon sperm?
Yeah, I mean, it sounds completely like science fiction.
Right. You hear that and you immediately think of, I don't know, some crazy dystopian sci-fi movie. But it is very real. And the clinical data behind it is completely upending how we think about human tissue repair. So welcome to today's deep dive. We have a truly fascinating mission for you today.
We really do.
Yeah, we are exploring a highly specific, cutting-edge regenerative treatment. Basically, using these purified fish DNA fragments to structurally rebuild human connective tissue right from the inside out.
And it really is a profound shift in, well, how we approach structural failure in the human body. Because to put this in perspective, think about a massive suspension bridge where, the central support structures just start to sag.
Okay.
Historically, our medical mindset has been very much like an old school engineer. We look for a physical patch for a physical problem, like we bolt on heavy steel plates or we just pour fresh concrete over the cracks.
And in the human body, those steel plates are, they're often literal synthetic surgical meshes. Or, we try to artificially prop up the system with systemic hormones.
Exactly. But today we're looking at a completely different, purely biological approach.
Right, we're asking, what if you could teach the concrete to heal itself? What if you could deliver the exact raw materials the bridge needed, right down to the microscopic level, so it can just, rebuild its own internal scaffolding?
That is the core of what we are unpacking today. We are looking specifically at the clinical evidence supporting polynucleotide therapy, which is often just abbreviated as PN therapy, and how it's being used to drastically improve endopelvic connective tissue strength.
Right, and just to give you a quick roadmap of where we're pulling this from, we've gathered a really diverse stack of research for this.
Yeah, a lot of ground to cover.
Definitely. We're looking through pharmacological data detailing the exact cellular mechanisms, clinical studies from aesthetic medicine, where this tech was actually pioneered, and some incredibly promising gynecological research papers focusing on pelvic floor surgery and intimate health.
And we really need to pause and emphasize the stakes here because, honestly, they are incredibly high.
Oh, absolutely.
We are talking about conditions like genitourinary syndrome of menopause, often called GSM stress urinary incontinence, and pelvic organ prolapse. I mean, these are not minor inconveniences.
No, not at all.
They're massive quality of life issues that affect millions of women worldwide, and they often cause them to suffer in silence due to, the stigma or just the fear of the current treatment options.
Yeah, and that fear is very real. I mean, if you paid attention to the news over the last decade, you've probably seen the massive lawsuits and just absolute horror stories surrounding synthetic pelvic meshes. And on the other side, the standard treatment often relies on systemic hormone replacement therapy. But, well, what if a patient is a breast cancer survivor who absolutely cannot take estrogen? Or what if someone simply just doesn't want to introduce systemic hormones into their body?
Exactly. The medical toolbox has been frustratingly limited. That's why finding a non-hormonal biological alternative is such a desperate need in women's healthcare right now.
Which is why the introduction of polynucleotides is capturing so much attention. But before we can grasp how this actually strengthens a failing pelvic floor, we need to demystify what this material actually is.
And just as importantly, how it behaves once it gets past the human immune system.
Right, let's address the elephant in the room. Because when you tell someone you are injecting fish DNA into their most sensitive tissues, you're going to get some seriously raised eyebrows.
Yeah, I'd imagine so.
So looking at the chemical breakdown in our research, polynucleotides, or PNs, and polydeoxyribonucleotides, PDRNs, they are indeed DNA fragments, and they're typically sourced from the sperm or gonads of salmon and trout.
I know the immediate reaction to that might be a bit of a shudder for some people, but the key to this entire therapy, and the reason why it actually works, is the intense purification process.
Right.
The raw material goes through an extremely high temperature extraction.
And that heat is the secret weapon, right?
Yeah.
Because looking at the data, that high temperature process, it completely obliterates all the proteins and peptides from the original material.
That's the crucial detail. When a human body rejects a foreign substance, like when you get an allergic reaction or an immune response, it is almost always the host's immune system attacking foreign proteins.
Oh, interesting.
Yeah, so because this thermal purification process strips all of those proteins away, leaving behind nothing but the pure, naked nucleotide chains, the immune system doesn't even recognize it as foreign.
Wow.
The clinical data shows virtually zero immunogenic risk, like no allergic reactions.
So just to be crystal clear for you listening, because, The market is flooded with so many different treatments right now.
Mm-hmm.
These are not cosmetic fillers.
No?
They aren't going in to just physically take up space. There aren't hormones signaling your endocrine system, and they certainly aren't neurotoxins, like Botox, paralyzing a muscle.
Right, exactly.
They are just raw, fundamental biological building blocks.
Yes. And once they are introduced into the endopelvic tissue, they don't just sit there. They operate through two very distinct, very powerful biological mechanisms.
Okay, let's break those down.
So the first is what we call a signaling mechanism. These polynucleotides are uniquely shaped to target and bind to specific receptors on the surface of our cells, which are known as adenosine A2A receptors.
Now, when I was reading about this A2A receptor, it sounded less like a chemical reaction and more like a master control switch on a fuse box.
That's a good way to look at it.
Because when the PN binds to that receptor, it flips the switch and triggers a massive chemical domino effect inside the cell. It basically does two things instantly. It shuts down the body's inflammatory alarm bells, and it commands the tissue to start building new blood vessels.
That is a perfect way to visualize it. On the inflammation side, flipping that A2A switch drastically reduces the aggressive pro-inflammatory signals that are actively damaging the tissue, while simultaneously boosting anti-inflammatory ones. You're basically putting out the biological fire in the tissue.
Right.
And then on the blood vessel side, that same switch triggers the release of something called VEGF, which is vascular endothelial growth factor.
And blood flow is everything when it comes to healing, right?
Yeah.
And if tissue is damaged and inflamed, it's usually starved of oxygen. So by forcing the body to build brand new blood vessels, a process called angiogenesis, you are literally reopening the supply lines to a dying area.
Exactly.
Yeah.
It creates the perfect environment for regeneration. You've put out the fire and you've reopened the roads. But the second major mechanism is where this gets truly revolutionary.
Okay, lay it on us.
The clinical papers refer to this as the salvage pathway. Over time, these long chains of polynucleotides are naturally broken down by our own enzymes into individual raw nucleotides.
And this is where it gets into the heavy lifting of tissue repair. Because, well, building new DNA to repair damaged tissue from scratch takes a lot of work.
An immense amount of work. Creating new building blocks from scratch, which biologists call de novo synthesis, it requires massive amounts of cellular energy.
Energy that these stressed, damaged, oxygen-starved cells simply do not have.
Precisely.
Okay, let's unpack this. It sounds like instead of forcing a starving, damaged cell to, go out into the forest, chop down trees, mill the lumber, and then try to frame a house.
Right. They'd collapse before they even poured the foundation.
Yeah. So instead of all that, polynucleotides just drop off pre-cut 2x4s directly at the construction site.
That metabolic shortcut is exactly what's happening, because the raw nucleotides are the 2x4s.
Okay.
The exhausted cells, the fibroblasts that build our connective tissue, they don't have to manufacture anything. They just pick up the pre-cut materials and immediately start hammering them together to build type I collagen. And because they have the raw materials handed to them, they can rapidly ramp up that synthesis. But it actually goes even deeper than that.
Oh, really?
Yeah. While they are building new scaffolding, the polynucleotides also actively inhibit an enzyme called MMP1.
Which, if I remember the pharmacology right, is the enzyme that acts like a demolition crew, just going around and chewing up existing collagen.
Yes. So consider what's happening simultaneously here. You're supplying the raw materials to build new scaffolding faster than ever, and you have fired the demolition crew that was tearing the old scaffolding down.
That's incredible.
You shift the entire biological momentum of the pelvic floor from degradation and decay straight into active regeneration.
Which naturally leads to the next big question. If these polynucleotides are so incredibly good at stopping the demolition crew and building new collagen, why are researchers targeting the pelvic floor? Because theory is great, but repairing a prolapsed organ is a massive biological ask.
They are focusing there because that is exactly where the structural scaffolding of the female body is quietly, profoundly failing.
Okay, so this is the core problem in endopelvic tissue.
Yes. We tend to think of things like stress urinary incontinence, where a sneeze or a cough causes leakage, or pelvic organ prolapse as mechanical failures. And they are intrinsically linked to degraded collagen metabolism.
Yeah, the research on this was just stunning to me. We looked at one specific clinical study that examined the tissue of women suffering from genital prolapse. And what blew my mind is that even in young women with prolapse, they found a marked, highly measurable reduction in the actual collagen concentration within their pelvic connective tissues compared to healthy individuals.
It is a literal structural failure at the microscopic level. The medical literature refers to this as a loss of trophism.
Trophism, okay.
Essentially, the pelvic organs and the vaginal mucous membranes, they lose their cellular nourishment, they thin out, they lose their elasticity, and their structural integrity just collapses. And this degradation drastically accelerates due to, well, the natural aging process, the massive hormonal drops during menopause, or the severe physical trauma of childbirth.
Here's where it gets really interesting for me, though. We usually hear about these pelvic issues treated as muscle problems, right? Like,
Yeah.
oh, you just need to do your Kegels.
Right, always Kegels.
Always. But the sources are framing this as a literal connective tissue failure, a loss of structural glue. Is that right?
It's a vital distinction to make, and it changes the entire treatment paradigm. Are the pelvic floor muscles important? Absolutely. But muscles don't just float in empty space.
Right.
The connective tissue, that collagen matrix we've been talking about, is the scaffolding that anchors those muscles to the bones and the organs.
It's like having this state-of-the-art, incredibly powerful elevator motor, but the steel cables holding the actual elevator car are fraying and snapping. It doesn't matter how strong the motor is if the cables can't bear the load.
That is a brilliant way to put it. You can have the strongest pelvic floor muscles in the world, but if the collagen matrix connecting them to the bladder, the uterus, or the rectum is depleted and fragile, the tissue will simply stretch and fail to support the organs. That's why a treatment that can directly stimulate type I collagen synthesis without relying on systemic hormones is capturing so much attention in urogynecology.
Okay, so since the root problem is a lack of collagen scaffolding, let's look at the actual clinical evidence. What happens when these purified salmon DNA fragments are introduced into a living patient's endopelvic region?
Well, the clinical data is robust across several different applications, but let's start with the vaginal environment itself. Specifically, genitourinary syndrome of menopause, or GSM.
Right.
The studies detail how intradermal vulvar injections of PNs directly address the severe structural symptoms of vulvovaginal atrophy.
And we should contextualize what that actually means for a patient. Because vulvovaginal atrophy isn't just, dryness. We are talking about tissue that has become so thin and fragile that it causes micro tears, chronic pain, and an inability to even sit comfortably or wear certain clothes, let alone engage in intimacy. I mean, it is debilitating.
It truly is. And the clinical trials show that by introducing PNs directly into that compromised tissue, it doesn't just soothe the area. It fundamentally restores tissue elasticity, it measurably thickens that fragile paper-thin skin, and it dramatically improves natural moisture levels by rebuilding the healthy tissue architecture.
That's amazing.
Yeah.
But the research doesn't stop at just injections. What I found absolutely wild was their use in actual open pelvic floor surgery.
Yes.
The sources cite specific studies where polynucleotides are combined with an antimicrobial agent called terpenanol to create these things called PT ovules. Surgeons are using these as wound healing adjuvants during and after complex pelvic floor repairs.
And this addresses one of the most frightening complications in pelvic surgery. When a surgeon uses a synthetic mesh to hoist up a prolapsed organ, there is a risk of something called mesh exposure.
Yeah, that sounds bad.
It is. This is where the patient's vaginal tissue fails to heal over the mesh, it breaks down, and the rough synthetic mesh essentially protrudes through the vaginal wall.
Ugh, which just sounds horrific. I can only imagine the pain, the risk of infection, and the fact that it usually requires more invasive surgery to try and fix it.
It is a nightmare scenario for everyone involved. But the clinical data shows that when these PT ovules are used, they form a protective biological film over the surgical site.
Oh, wow.
Yeah, they immediately restore the optimal vaginal pH to a healthy 4 or 4.5, which wards off infection. But most importantly, the PNs stimulate such rapid cell regeneration that they are highly effective in actively preventing that mesh exposure from ever happening.
So the tissue heals thicker and faster over the mesh.
Exactly. Thicker, faster, and stronger.
That is a massive leap forward for surgical outcomes. But looking through the stack of research, I appreciate that the scientists looked beyond just the microscopic tissue mechanics. They actually measured the real-world human impact, the quality of life.
Yes, the quality of life data is arguably the most important part of this entire deep dive. Researchers used an internationally validated metric called the PAIR scale, which stands for the Personal Assessment of Intimacy in Relationships.
Right.
They tracked menopausal women who underwent a protocol of 5 PN injection sessions.
And the results weren't just a slight improvement. The data showed statistically significant transformations in their sexual lives and overall relationship intimacy following that 5-session course.
Hmm.
It literally saved marriages by removing the physical pain that was destroying that connection.
It's a true testament to what happens when you actually fix the underlying structural issue rather than just masking the pain.
Okay, but hold on. I'm looking at this data, specifically the part about how PNs form this hydrophilic gel, and my skeptical brain is kind of flashing a warning light.
Okay, let's hear it.
Well, hydrophilic means it binds to water, right?
Right.
So I can see how the immediate hydration works, but building actual connective tissue takes time.
So what does this all mean for the patient? Are these just temporary Band-Aids that wear off in a month? How is this any different than a cosmetic filler that just wears off, leaving the patient right back at square one?
That is the exact skepticism you should have, really. And it gets to the very heart of why this is classified as regenerative medicine, not just cosmetic symptom management.
Okay.
To understand it, we have to separate the biological timeline into active, immediate results versus passive, long-term results.
Walk us through that timeline. What happens on day 1 versus, say, month 3?
On day 1, you get the active result. As you noted, the polynucleotides form a hydrophilic 3D gel structure. It acts like a sponge, pulling in water. That provides immediate, intense hydration and a volume-increasing effect.
Right.
For a patient in severe pain from tissue atrophy, that immediate hydration is a godsend. It's the active short-term relief. But the long-term passive action is where the genuine regeneration happens. Oh, this goes back to the salvage pathway and the pre-cut 2x4s we talked about earlier.
Precisely. Over the following weeks and months, that gel doesn't just sit there. It is constantly being broken down by enzymes, continually replenishing the fibroblast pool with those raw nucleotides. The body is using those materials to produce brand new, native collagen fibers.
So it's not a foreign substance holding the tissue together permanently. The fish DNA eventually metabolizes and completely disappears from the body.
Completely disappears. But the new, dense collagen matrix that it tricked your body into building, that stays. It belongs to you. It is a permanent structural change to the tissue, reversing that loss of trophism.
So you haven't just plumped a flat tire, you've actually manufactured brand new, thicker rubber for the tire itself.
Exactly.
Which brings us to the final piece of the puzzle in our research stack. The clinical evidence shows PN therapy is powerful on its own, but modern regenerative medicine is really moving away from monotherapy, right?
Yeah, the vanguard of this research is looking at how these DNA fragments synergize with other molecules.
And the most prominent successful synergy highlighted in the literature is the co-formulation of polynucleotides with hyaluronic acid, or HA.
Right.
Now, I think a lot of people listening will instantly recognize hyaluronic acid from, like, their daily skincare serums. It's famous for its ability to hold massive amounts of moisture.
It is arguably the best hydrating agent we have, but the clinical researchers noticed a fascinating dynamic when you combine HA with polynucleotides in the pelvic floor.
What did they find?
While the HA provides incredibly potent immediate hydration to that parched, fragile endopelvic tissue, the PNs are actually far more potent at driving the long-term structural collagen production. Together, they synergize perfectly.
So it's like a dual-action rescue mission. The hyaluronic acid is the emergency relief team providing immediate water and support, while the polynucleotides are the long-term biological repair crew rebuilding the foundation.
I couldn't have phrased it better. That's highly accurate to the clinical outcomes. The HA stabilizes the immediate cellular environment, which actually makes it easier for the PNs to reach those A2A receptors and feed the fibroblasts.
Oh, that makes sense.
Yeah, it is a multi-target approach that tackles the immediate pain and the long-term structural collapse simultaneously.
And as we look at all of this together, we really need to drive home why this specific clinical evidence is such a game changer. This offers a highly effective, strictly non-hormonal, non-surgical alternative.
Right. If we circle back to the reality of women's healthcare, there is a massive demographic of patients who simply fall through the cracks of traditional treatments.
Yeah.
Women with a history of hormone receptor-positive cancers, those with severe cardiovascular risks, or frankly, women who just prefer not to alter their systemic hormone levels. And even for those who do use HRT, sometimes those systemic hormones completely fail to resolve the localized tissue atrophy in the vulvovaginal region.
So what this all means for you, the listener, is that science has finally found a purely structural biological repair mechanism. You can achieve targeted, local regeneration of the pelvic floor without introducing a single systemic hormone into your bloodstream.
It is redefining the global standard of care. We are finally moving away from the era of merely masking symptoms with creams or relying on invasive, risky synthetic meshes and moving toward genuinely regenerating the endopelvic structural matrix using the body's own cellular machinery.
It really is a paradigm shift in how we view the human body. Let's just recap the journey we've taken today.
That's good.
We started with the analogy of a failing bridge, where the old school mentality was to rely on heavy steel plates and temporary fixes. But we've seen how modern medical science has found a way to let the tissue rebuild itself. By taking highly purified DNA fragments from salmon, completely stripped of any allergy-inducing proteins by high heat, we can introduce them directly into the failing pelvic floor.
Where they go to work instantly. They act as a signaling molecule, flipping those A2A receptor switches to shut down destructive inflammation and build new blood vessels.
Right.
And simultaneously, they act as a raw material supplier, feeding the salvage pathway so the exhausted fibroblasts can rapidly produce fresh, new type I collagen while stopping the enzymes that destroy it.
And the clinical evidence we reviewed proves this isn't just a neat biological theory. From reversing the debilitating, painful symptoms of vulvovaginal atrophy to forming a protective shield that prevents horrific surgical complications like mesh exposure, to genuinely restoring intimacy and saving relationships for menopausal women. It is a highly effective, non-hormonal therapy that literally rebuilds the structurally compromised connective tissues of the body.
It is one of the most remarkable applications of biochemistry to solve a fundamentally mechanical problem that we've seen in decades.
It really is. And I want to leave you with a final, slightly provocative thought to mull over as we wrap up today's deep dive. We've spent a lot of time today talking about using these polynucleotides to heal tissue, to improve the results of existing surgeries, and to ease the natural symptoms of menopause. But if we are now truly capable of using raw biological building blocks to trick the body into structurally rebuilding its own pelvic floor from the inside out, could these sequence-specific protocols eventually replace the need for invasive surgical interventions or synthetic meshes entirely in the future?
That is a profound question.
Right, like could we reach a point where surgery is no longer the last resort, but just a relic of the past?
Looking at the trajectory of this clinical data, it is definitely a possibility we need to keep a close eye on as regenerative medicine continues to evolve.
We might just be looking at a near future where we never have to bolt steel plates to the bridge again, simply because we finally taught the bridge exactly how to heal itself. Until next time, keep diving deep.